Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what we have from the medical world. Use of renin angiotensin system inhibitors to affect the kidney vessels. Hypertension is a severe disease with dire consequences known to affect more than 1 billion people worldwide and is a major risk factor for cardiovascular diseases, stroke, end-stage renal disease, and even death. The deletion of renin or the inhibition of the RAS leads to concentric thickening of the intrarenal arteries and the arterioles, according to a study that has been recently published in the Journal of Clinical Investigation Insight. This severe disease is resulting in the blood flow obstruction, focal ischemia, and even fibrosis. The study thereby concluded that the renin cells are responsible for vascular diseases. Anxiety in men to be a risk factor for cardiometabolic diseases. Anxiety is a condition often causing restlessness and tension and also increases the heartbeat. It can be a normal reaction to either stress, but however, when prolonged, anxiety is the root cause of several cardiometabolic diseases. Anxiety has been found to be linked to elevated risk of cardiometabolic disease onset, and the study in the Journal of the American Heart Association mentions that prospective association of two anxiety facets, namely neuroticism, which is experiencing negative effects from within, as well as worry by the middle adulthood, and higher anxiety levels are associated with stable differences found increased in cardiometabolic risks. Epidural anesthesia during labor linked to faster stomach emptying. Anesthesiologists prefer that laboring women have an empty stomach because of the lower risk for aspiration, that is inhaling of food, in case of general anesthesia for cesarean section becomes necessary. Now, regarding this issue, a study published in the online First in Anesthesiology finds that stomach emptying is substantially slower during labor, but somewhat found to be faster in women who receive an epidural for pain control. The results suggest that anesthesiologists should remain cautious without permitting solid food during labor, especially when epidural analgesia is not used. Procalcitonin helps predict severe bacterial infections in children aged 3 months or less. Fever in infants under 90 days of age is highly likely to be caused either by a bacterial infection, and it accounts for a large number of patients visiting the pediatric emergency room. Now, in order to predict the bacterial infection and also reduce the unnecessary treatment, the classic classification system is based on the white blood cell count, the urine analysis, and X-rays, and it is often modified and applied at each center by incorporating recently studied biomarkers such as C-reactive protein or procalcitonin. The study is published in the BMC Pediatrics Journal, where the authors analyzed that procalcitonin is found to be useful in predicting severe bacterial infections in younger children. Bone grafts and substitutes in dentistry, an emerging trend. After tooth loss, bone resorption is irreversible, leaving the area without adequate bone volume for successful implant treatment. Bone grafting is the only solution to reverse the dental bone loss and is a well-accepted procedure required in 1 in every 4 dental implants. The bone graft material may be taken from one's own body, that is autogenous, or it may be purchased from a human tissue bank, which is the allograft, or an animal tissue bank, which is often called the xenograft. Tissue engineering hybrid constructions with enhanced bone regeneration ability are emerging areas of development, according to a study published in the Molecules Journal. It was hence concluded that this particular concept, that is tissue engineering hybrid constructions with enhanced bone regeneration ability, is the new step ahead. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.